Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through September 16th, 2021. Today, I'm going to address a question that comes up quite a bit, which is what's going to happen next? What's going to happen with this pandemic? People look at the pattern that we've seen and say, okay, what's going to be next? We've had this rapid rise in deaths back in March and April, a steady number of daily deaths through much of the summer, and then these spikes, first in the winter, then in the early spring, and now one appears to be going on now. And people say, what's going to happen next? And the reality is, no one knows for sure, because one possibility is that we'll see, if you look at these spikes, seem to be getting slightly lower, and maybe we'll just see it gradually decrease towards nothing. That would be great, but we don't know for sure, because we might also see a continuing undulation going up and down this sort of continuous sawtooth pattern, or at its worst, we could even see spikes, higher numbers of deaths. So the reality is, at this point, none of us know for sure, and anyone who tells you definitively what's going to happen is probably using something other than science to make their predictions. So what do we know at this point? Well, we know the pandemic is not over, right? 4.5 million deaths worldwide. In the US, approaching 700,000 deaths. In Tennessee, over 14,000 deaths. And that's about one death for every 480 Tennesseans. So the pandemic is not over. The second thing we know is that we've seen an increase in cases and hospitalizations recently, which suggests that we will see more deaths in the near future. If you look worldwide, even though this appears, the number of daily cases appears to be coming down, it's still very high. And that means that we're going to have more hospitalizations and deaths. The same with daily cases in the United States. Again, whether it's coming down or leveling off is a bit hard to say, but it's still at the highest point it's been since the winter, the big spike in the wintertime. And then in Tennessee, in terms of daily cases, we're actually seeing as many now as we've seen at any point in our history. In terms of hospitalizations, again, we see this same undulating sawtooth pattern. And again, while the numbers may be coming down, it's still very, very high, which means we're going to have more people in the ICU and more people dying. In terms of daily hospitalizations in Tennessee, you see the same pattern. And if you look at Ballad Health, our regional health system, while the number may or may not be coming down, it's higher than it's been at any time in terms of hospitalizations. So we can reasonably expect that not only is the pandemic not over, but we're going to see more deaths in the near future. We know that the more that the virus spreads, the greater the chance of a more lethal variant. Okay, so I've shown you this before. A virus comes into the body, it circulates and it spreads, and then by the time it leaves the body, it has changed a little bit. Now, in most cases, most of these mutations don't really matter, right? But if a mutation makes it easier to spread, like the Delta variant, then it's going to be more widespread. But it could also make it more lethal. It could kill more people. We do know that coronaviruses, there are some that are much more lethal than SARS-CoV-2 and more likely to avoid the body's immune system. So the more it spreads in society, the greater the chance that something bad is going to happen with it. And finally, information continues to suggest that vaccinations reduce serious illness, hospitalizations, and deaths. This is a chart that I've shown you before. I've updated it for this week. This is vaccination for all 50 states. You see, there are some states up here with between 65 and 70% vaccination. There are a bunch of states back here with under 45% vaccination rate, including Tennessee. And this is deaths per 100,000 in the past week. And what you can see is a pretty good relationship. In fact, if you look at the 10 most vaccinated states, they have about 1/3 the number of deaths in the last week on a rate basis than the least vaccinated states. All right. And the same, but I don't show it here in the chart, but I calculated the same thing, about 3 times difference in hospitalizations. So vaccinations make a huge difference. So what do we know at this point? The pandemic is not over. Increases in cases and hospitalizations suggest that we'll see more deaths in the near future. The more the virus spreads, the more the chance of a more lethal variant. And we if we don't get people vaccinated, we're going to see more serious illness, hospitalizations, and deaths. So what's going to happen next? Well, no one knows for sure, but it really depends on how many people get vaccinated, both in the United States and around the world. Because if the virus is spreading in another country and a new variant develops, it could still come in to the United States. And it also depends how the virus mutates. And this one is a little bit out of our control, right? As long as it continues to mutate, there is a chance of a more serious or more lethal variant. And then it depends in a way on whether the COVID infections overwhelm our healthcare system. So no one can say definitively what is going to happen. What we can say is that the data that we have today strongly suggests that people need to get vaccinated as quickly as possible and as many people as possible. That appears to be the best chance we have of controlling our own future. If we don't get vaccinated, the odds are pretty good that we're going to see continued spikes in deaths, hospitalizations, and serious cases. Maybe that'll happen even if we are vaccinated, but the odds are what looks strongest evidence is we need to get folks vaccinated. A great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let me know. I'd like to thank Dara Young for editing, producing, and posting this video. And as always, I look forward to hearing your questions because that lets me know whether what I'm saying makes sense or is confusing, and also what issues you have. I look forward to hearing from you. So until next week, please be well.